name is Noelle Ahn, and for my capstone project, I'm doing on glioblastoma. Glioblastoma, also known as glioblastoma multiforme, GBM, is the most aggressive and most common type of cancer that forms in the brain and has very poor prognosis for survival. Glioblastoma is a type of cancer that starts as a growth of cells in the brain or spinal cord. It grows quickly and can invade and destroy healthy tissue. Glioblastoma formed from cells called astrocytes. An astrocyte is a large star-shaped cell that holds nerve cells in place and helps them develop and work the way they should. Glioblastoma represents 50% of all brain tumors. Glioblastoma is the most common cancer that begins within the brain and the second most common brain tumor. A glioma is one of the most common categories of primary brain tumors. Glioma is a term for cancer of the glial cells that surround nerve endings in the brain. Glial means glue, and these cells provide support for neurons, which are responsible for walking, talking, thinking, seeing, and more. Gliomas are categorized into grades according to how aggressive it is. Grade 4 gliomas are the most aggressive type. Example of a grade 4 glioma is glioblastoma. Brain cancers are graded instead of staged. Grades indicate how the cancer cells appear under a microscope, as well as how likely they are to reproduce. Like stages, brain cancer grades range from 1 to 4. The higher the grade, the more aggressive the cancer. A symptom of glioblastoma is a headache. These are often the first symptoms of glioblastoma. Brain tumor headaches can differ from normal headaches. They usually become more frequent over time and may not respond to over-the-counter pain medicine. They may cause nausea or vomiting and can get worse when you lie down or bend over. Seizures. Seizures can take many different forms. While most people have seizures with uncontrollable arm and leg movements and a loss of consciousness, symptoms can be less noticeable. Other seizure symptoms include numbness, tingling, difficulty speaking, strange smells or sensations, staring, and unresponsive episodes. Changes in mental function, mood, or personality. Brain tumors can cause people to become moody or inefficient at work. They may feel drowsy, confused, and unable to think. Depression and anxiety, especially if either develop suddenly, may be an early symptom of a brain tumor. Changes in speech. People with brain tumors may have trouble finding words, speak incoherently, and be unable to express or understand languages. Sensory changes. Changes in the ability to hear, smell, or see, including double or blurred vision, can be symptoms of a brain tumor. The sense of touch can also be impacted. People with brain tumors may lose some of their ability to feel heat, cold, pressure, sharp edges, and light touches. Another symptom of glioblastoma is a loss of balance or coordination. Changes in pulse and breathing rates. This symptom usually occurs when a brain tumor compresses the brainstem. The brainstem controls basic bodily functions, including breathing and the heart rate. Although glioblastoma can happen anywhere in the brain, it usually forms in the frontal and temporal lobe. Glioblastoma can rarely occur in the brainstem or spinal cord. The frontal lobe is one of the 5 lobes in the brain. It's considered the largest and is located in the front part of your brain. The frontal lobe manages thinking, emotions, personality, judgment, self-control, muscle control, movements, memory storage, and more. The temporal lobe is considered the second largest lobe and is located behind the ears. The temporal lobe manages senses like pain, hearing, helps you understand languages, helps you recognize objects, helps with speech, helps with controlling unconscious reactions like hunger, thirst, appetite, and more, and it helps process and remember emotions. What does it look like? This is a picture of glioblastoma in the brain. This glob is glioblastoma tumor. Who gets it? Glioblastoma can happen at any age, even adults. In children, glioblastoma is most common in kids between the age of 8 and 18. Each year, around 500 children in the U.S. are diagnosed with glioblastoma. Survival rate. Despite maximum treatment, glioblastoma almost always reoccurs. The typical duration of survival following diagnosis is 10 to 13 months, with fewer than 5 to 10% of people surviving longer than 5 years. Without treatment, survival is typically 3 months. The 5-year survival rate for glioblastoma patients is only 6.8%, and the average length of survival for glioblastoma patients is estimated to be only 8 months, although the average life expectation after diagnosis is 14 to 16 months. Approximately 1% of patients survive at least 10 years. Currently, the longest anyone has survived glioblastoma is more than 20 years and counting. The cause of most cases of glioblastoma is not known. Uncommon risk factors include genetic disorders such as neurofibromatosis. Neurofibromatosis is a group of genetic disorders that cause tumors to form on nerve tissue. These tumors can develop anywhere in the nervous system, including the brain, spinal cord, and nerves. Glioblastoma is typically diagnosed based on a physical exam, along with CT scans or MRIs. If the results come back showing a tumor, then they will do a biopsy. A biopsy is a surgical procedure where a piece of the tumor is cut away and removed for testing. There is no known method of preventing glioblastoma. Treatment usually involves surgery after chemotherapy and radiation therapy are used. Because glioblastoma is more aggressive, it is often treated with a combination of radiation therapy and a low dose of chemotherapy. Chemotherapy is a type of treatment that uses drugs to stop the growth of cancer cells, either killing the cells or stopping them from dividing. Radiation therapy, also called radiotherapy, is a cancer treatment that uses high doses of radiation to kill cancer cells and shrink tumors. It is possible to get surgery to remove glioblastoma, but glioblastoma often grows into the healthy brain tissue, so it might not be possible to remove all the cancer cells. That concludes my Capstone project. Thank you!